All right, so I just finished up making a video, just kind of covering a overview of the gross anatomy of the heart. And now I want to spend a little bit of time talking about the valves of the heart. Just because, it's just another very important topic to talk about. And I just, for time's sake, I was getting around 50 minutes with the previous video, and I didn't want to lump this in there, so I'm doing it separately. So on that note, let's get rolling. This video shouldn't be terribly long, but hopefully, as always, I hope these are useful to you folks while you're watching them. So, all right. So heart valves. So valves are, it's not just within the heart, but valves in general. Whether it's a valve somewhere in the engine of your car, it's a valve at a dam, a water dam, a valve in your heart, the main function of valves is to promote one-way flow. All right, so to promote one-way flow by preventing backflow. All right, so basically what I'm saying here is we're promoting one-way flow of blood throughout the chambers of the heart, because remember, blood enters the heart via the atria, goes down into the ventricles, and then the um, up through the great arteries of the heart. And, if we're talking about the right ventricle, blood will go up through the pulmonary trunk, out the pulmonary arteries, into the lungs for gas exchange, you know, collecting oxygen, unloading CO2 simultaneously. And then with the left ventricle, we're talking about blood going out the aorta and then to the systemic circuit to the rest of the body for gas exchange, just in the opposite manner of the lungs, unloading oxygen and collecting CO2 in the tissues. Um, but valves are important because we don't want that blood. For example, if we're talking about blood in the ventricles, so let's say we've got a bunch of blood let's say we've got some blood sitting here in the ventricles. All right, we want that blood to go up and out. All right, plain and simple. We want that blood to go up and out. We don't want it to go backwards up into the atria, or from the great arteries back down into the ventricles of the heart. So that's why it's important that we have these valves here and that they open and close at very precise times. When the chambers are contracting or relaxing. Now, one thing to keep in mind, I'm going to say this now, and I'm going to come back to this concept later in later videos. That Remember, your upper chambers are I'm just gonna keep it short. The upper chambers are the atria, and the lower chambers are the ventricles. Right. So put the other A here. Um, okay. Now I'm gonna say this to you right now. While the atria are contracting, the ventricles are relaxing, and vice versa. When the ventricles are contracting, the atria are relaxing. Okay, now I'm going to repeat that, then I'm going to give you a second because I want you to think about why that's important. While the atria are contracting, the ventricles are relaxing. And while the ventricles are contracting, the atria are relaxing. Now, why do you think that's important? Why do you think it's important that all four chambers never simultaneously contract at the same time? Well, for starters, there would be no pumping going on. If all four, remember the word contract means to shorten, right? And you know that the thickest tissue of the heart is the myocardium, all right, and especially the myocardium of the ventricles. All right, so if we had all four chambers squeeze at the same time and the heart got smaller at the same time, well, where would blood go? It would go nowhere, right? It would just stay in the heart. All right, so it's very important that while the atria are contracting, the ventricles are relaxing and blood is filling into the ventricles. And then and then very quickly afterwards, the ventricles are going to be stimulated to pump or to contract or to squeeze, and then that blood will be ejected out of the heart and also will be returning back into the heart via the atria. Okay, so it's very important that that not only, while one set of chambers are contracting, the other are relaxing. It's important that this is all very well timed. Okay, and again, just I'm not going to get in depth with that right now because I want to talk about the cardiac cycle later on in another video, but you get the picture. All right, now where the valves come into this, the valves are important because excuse me, the valves, for example, while the ventricles are contracting, well, you can probably guess what the valves um, between the atria and the ventricles are doing. They're shut, right? Because we don't want, they close because we don't want that blood going backwards. And then same thing with the valves and between the ventricles and the great arteries, they're shutting when the ventricles are contracting. All right. So let's talk about those valves here for a second. So there are basically two types of valves, and in a total of four different valves located within the heart, four major valves, I should say, located within the heart that we'll tend to focus on. All right. And the two types of valves are called atrioventricular valves, often abbreviated AV. And, if you're one of my students watching this, I'm okay with you using the abbreviation AV. Just like with the interventricular septum between the ventricles, it's fine if you say IV septum. All right. And then so basically, I mean, just the name says it all. Atrioventricular. These are valves that are found in the orifices between the atria and the ventricles. All right, so they promote one-way flow from the atria to the ventricles. So if we kind of, doodle this out here for a second. All right, so let's say we've got the atria here, the ventricles down here. They're promoting, blood flows down into the atria, right, or I'm sorry, blood flows down into the ventricles from the atria. All right, and then when the ventricles contract, the valves shut, so the blood only has one way to go, up and out, except not up into the atria, but out through the great arteries of the heart. And I'll show you some pictures of this, some better pictures of this in a second. I don't want to subject you to my art for too long. All right, so you get the picture. That's the purpose of those valves. And there are, as I mentioned, there are two AV valves. There's one on the right side of the heart, and there's one on the left side of the heart. The valve on the right side of the heart is called the tricuspid valve, and the valve on the left side, I should say the left AV valve, is called the bicuspid. Or if you're one of my students, I pretty much, I make you learn both, but I tend to just say mitral valve because clinically you hear people say mitral valve way more often. So I guess so I say mitral valve all the time. I mean, you just hear it said more often. So I guess just get used to hearing mitral valve. I'm not saying people don't say bicuspid valve. I just personally have heard mitral valve a lot more often, and so that's just how I'm going to talk it out. So bear in mind when I say mitral, I'm saying bicuspid. So the tricuspid valve essentially, well, why do you think we call it that? Well, it has three cusps or three leaflets, and I'll show you an image of this in a little bit here. All right, so it's got three cusps, and you can probably figure out why the bicuspid valve is called the bicuspid valve because it has, well, two cusps. Okay, and the reason why it's called the mitral valve, um, give me a second to sit here and try to figure this out. What is that hat called that the Pope wears? Give up. It's called a mitre. Okay, the hat that the Pope wears is called a mitre. And the early anatomists, when they were studying the mitral valve, they thought it looked, kind of strikingly similar to, the mitre that the Pope wears, so they decided to name it the mitral valve as well. So that's why they call it that. All right. And then the cusps of the valve, as I talked about in my previous video, the gross anatomy of the heart overview, the cusps are attached to these muscles in the ventricles called papillary muscles via these chordae tendineae. This is the plural form for tendineae. All right. Um, Now, what else do I want to say about this? Oh, now being that the AV valve between the right atrium and the right ventricle has three cusps. There are basically three papillary muscles located within the right ventricle, and then since the mitral valve only consists of two cusps, there are two papillary muscles with sets of cords that are attaching to the two cusps. Okay, so you have to keep that in mind as well, and that's something to look out for again when you're actually in the lab, you're dissecting hearts, and you're looking at this. Look for how many papillary muscles there are and how many sets of cords are going to each muscle. All right, or going to each papillary muscle. All right, so those are the AV valves. And then the semilunar valves, these are basically between the ventricles and what we call the great arteries of the heart, the great arteries of the heart. And to simply put, they're called the great arteries because they're just big. All right, they're big arteries. I mean, the aorta they're the largest arteries of the body essentially, in terms of just overall diameter and size. Especially the aorta. The aorta is massive. All right, and these are even more simple to understand because you remember your basic anatomy. The right ventricle connects to the pulmonary trunk, and the valve between the right ventricle and the pulmonary trunk, right at the beginning of that pulmonary trunk, is called the pulmonary valve. Pretty simple. And then, so then you can figure the aortic valve is obviously the valve between the left ventricle and the aorta. Very simple. I mean, that's sometimes anatomists like to name things in a confusing fashion, and it's great what they did with these. This is great. Nice and easy. So the aortic valve is on the left side. The pulmonary valve is on the right side. Okay. So let's take a look at some of these. So basically, these are some of the internal chambers and the valves. So just remember anatomy review. Here is your IV septum, interventricular septum. I'm not going to write septum because I've said it enough times and you know it by now. And this would be essentially the left side of the heart. This would be the right side of the heart. So this would be obviously, which chamber this would be down here. This would be the left ventricle. I should probably use a different color besides red. This would be the left ventricle. This would be the right ventricle down here. Okay. And this right here would be the mitral valve. All right. The mitral valve. And then remember before I said in the previous video, and I'm going to say it again, remember that the right ventricle makes up most of the anterior surface of the heart, whereas the left ventricle tends to kind of wrap around. So I mean, part of it's anterior, but a good chunk of it is on the posterior side as well. And also the opening, to the aorta right there. That's the aortic valve tucked away way up there. Okay. And these semilunar valves also tend to have three cusps, and they're called semilunar valves because they look, kind of like three cusps of, half moons. All right, kind of up there. So hence the term semilunar. All right. Now, what's interesting about these valves as well is you got to pay attention to the shape of these because the semilunar valves, there's a reason why I drew them like this. All right, because they are cupped down. These valves tend to cup downward, and the AV valves almost tend to kind of almost make like a St. Louis arch shape like this. All right, and you'll see why in a second. Okay, so here's just some pictures of these valves. So let's take a look at the valves on the right side first. So let's take a look at these tricuspid valves. The tricuspid and the pulmonary valve. So the conus arteriosus, basically, what this is just, what the right ventricle, as it kind of as it ascends upward, it forms this cone-like shaped structure called, the conus arteriosus. And basically, what this is the beginning of the we're looking at blood being funneled up in towards the pulmonary trunk. All right, excuse me, and then right at kind of the end of this conus arteriosus in the beginning of the pulmonary trunk, you see this would be the pulmonary valve. Just gonna abbreviate this. Pulmonary valve. Normally, if I was on a smart board, I would write these out, but I'm on my computer at home and I'm using a stylus pen and it just doesn't work that well. So I pardon all the abbreviations, but hopefully you've got a book or something else in front of you while you're looking at this. All right. So that's the pulmonary valve, and then down here, well, being that we're on the right side of the heart, that would be the tricuspid valve. All right. So right here you see, so it's hard to see the three cusps, but what you can see right here, 1, 2, 3, you see three sets of cords going down to anterior, middle, and posterior papillary muscles. All right, so there are three of these cusps, or sometimes I like to call them leaflets, but we'll just go with cusps. That's the more appropriate term to use. But you can see these three cusps right here for the tricuspid valve. Now, here's how these things work. Now, I said a second ago that, so let's just kind of doodle my horrid rendition of a heart here. So let's say we've got these valves right here, and then they've got these cords attaching to papillary muscles. Now, if you just look at the structure of this, if you've got your textbook in front of you and you're looking at the structure of this, you naturally would want to take a look at this just overall design, and you'd want to say to yourself, well, the papillary muscles must contract to pull to yank the valves downward, okay, and to make them open up more easily so blood can flow more easily between the atria and the ventricles. That couldn't be any further from the truth. It's natural. I mean, it's just natural to want to say that. And it has to do with the timing of when these papillary muscles actually contract. All right. When these muscles contract, all right, and if this doesn't make complete sense to you right now, it will later on when I'm going over the cardiac cycle or someone else going over the cardiac cycle and you're studying it. All right. But when these papillary muscles are stimulated to contract, they're also contracting simultaneously with the ventricles. All right. So, and I'm glad I'm talking about this now while I've got this picture up because I think this hopefully should drive this concept home. All right. So what's going to happen then is when the ventricles contract, remember before, just of your basic knowledge of the function of the ventricles, they pump blood out of the heart. All right. And obviously that blood has to go up in order to go out because the ventricles are the lower chambers of the heart. And you know the great arteries are found on the upper side of the heart. All right. So naturally, blood is going to want to just, if you squeeze a fluid, up towards an opening, and there is an opening, fluid's going to want to go through it, or in this case, a gel, but it's same picture, same concept. All right. So at the same time, when the papillary muscles, when the ventricles are contracting, the papillary muscles are actually going to contract as well. And what they're going to do is they are going to pull the cusps downward, but they actually make the valves close more tightly because that blood is naturally going to want to go back up. Remember before, up through openings, right? So what's going to happen, because remember I said these valves are kind of arced down like this a little bit. When these valves shut, all right, when these valves shut while the ventricles are contracting, all right, the papillary muscles are going to pull down on these cords, and what's going to happen is that's going to make these valves kind of bow upward a little bit, but the way they all close, they're going to form a really tight seal. All right, and then blood is going to push up against these valves, but again, they're going to have this tight seal form. So blood will be pushing up against these valves, and since it can't escape through here, it's only got one way to go out through the pulmonary valve and into the pulmonary trunk, because by design, because notice how these cusps are designed, how they kind of curve, the opposite direction, away from blood flowing. As blood hits those valves, it'll just kind of push them apart, push them open, and then enter the great arteries. And the same thing is happening with the aortic valve on the left side of the heart as well. That's kind of the basics of valvular mechanics. All right. So you get the picture here. So that's how the AV valves prevent backflow. The papillary muscles contract at the same time that the ventricles are contracting, and when that blood is being pushed up towards the atria, all right, they're more or less creating resistance against that blood flow with that tight seal they create, and they're forcing blood up into the great arteries of the heart. Okay, that's kind of a cool little, I think that's a neat little design we have there. And if there is ever any problems, if there's any valvular prolapse or whatnot, where these valves don't form a tight seal, then, well, blood will regurgitate up into the atria. Then you can obviously hear that when you're hearing the heart sounds, and that's obviously not something you want to hear, because you want one-way flow of blood to maximize your gas exchange. All right. Um, and so that's basically the tricuspid valve. And remember, even though I'm only showing you the tricuspid valve right here, the mechanics are exactly the same with the mitral valve, except there's only two cusps we're working with instead of three. And bear in mind, I've said this in the previous video and I said it in this video, that when the ventricles are contracting, the atria are relaxing. So there's never a point in time in a healthy heart when all four chambers are bloom, they're contracting, pumping, squeezing at the same time. Okay, which is good, because if the atria were to contract at the same time, well, they would create a downward pressure, downward force, and that would probably make the valves pop open, or it'd be harder to keep them shut. All right, so that's something to keep in mind. And then, this is just, so those are the valves on the right side. And then again, just if you take a look at the similar view, just different model, and this is honestly all that's left of this poor model, as I talked about in the last video. So again, if there's any teachers out there watching this, please take it from me. Don't let people borrow your models, because there's a really good chance they'll come back not in one piece, and make sure your students aren't mishandling them. I had to chew one out because they were, but anyway, I'm not going to get into that. But but anyway, so here again, you can see the mitral valve, and then way up here, the aortic valve. This valve, out of the four valves, this one tends to go the most. The semi-lunar valves are just thinner. They're not as well structured as the AV valves with their tendinous cords, the papillary muscles, and so on. And the left ventricle has, there's a lot more pressure and force in the left ventricle than that of the right, because remember, as I said in the previous video, as to why the myocardium is 3 times more thick on the left versus the right side. And I'm specifically talking about the ventricles here. Because of all that peripheral resistance of all the small capillaries, just all of the tissues that the left ventricle has to get blood out to, blood is leaving here with a lot of force, and and this valve, it's not as common as heart attacks, but it is, it does go. And then there are two routes people tend to take in terms of treating this. You can get an artificial valve, which they'll essentially take out of a pig and put it in you, or you can get a mechanical valve. And there's pros and cons to both. I mean, if you get a pig valve, there's a good chance, within a decade, it's probably going to fail, and you'll have to replace it, or just get a mechanical valve at some point in time. But the upside of that, you really probably won't have to worry about taking a lot of medications or anything. But with a mechanical valve, you'll definitely have to be taking anticoagulants, just because mechanical valves just tend to throw clots a lot more easily. So you have to be on a steady regimen of anticoagulants while taking those. But mechanical valves, just those really aren't going to fail all that much. So like I said, there's pros and cons to both. So the mitral valve on the left, the tricuspid valve on the right, those are your two AV valves. And then here you can see the pulmonary valve and the pulmonary trunk, and then the aortic valve going to the aorta. And again, if you take a look at this picture here, you can get a really good grasp of just how far back that aortic valve is. Because remember, again, I can't say it enough, just how much the left ventricle just kind of wraps around the posterior side of the heart. Okay, and then this is an actual image of the mitral valve. So here's the left atrium, and then right here you can see the two cusps. So this would be one cusp right here, and then this would be another cusp right here. So there are only two cusps, and then if you look at it upside down, it looks like the Pope's mitre. By the way, so you've got a cusp here, then you've got these cords, and you've got another. Gosh darn it! See, then you got another cusp here, cords, and it looks. If you were to kind of do this, it would look kind of like a Pope's mitre. Okay, that's why they call it that. All right, but this is neat. I couldn't really find a good picture of the right side of the heart, but if we were looking at the right side, you would see another set of cusps, or another cusp, not another set. So that's kind of neat. Um, and then if we take a look at this model, it's quite important that you kind of understand this as well. So this would be the right side, this would be the left side, and then obviously these would be the. So let me ask you this, just quiz you real quick. Which valve is this right here? And which valve is this right here? Remember, this would be your pulmonary valve, and this would be your aortic valve. Okay, because remember, for starters, the pulmonary trunk, um, the pulmonary trunk is going to be anterior to the aorta, and the aorta will be posterior to the pulmonary trunk. And you can see again, you can see how these cusps of the semilunar valves dip downward, which is really neat if you think about how the mechanics of how these valves work, because while the ventricles are contracting and they're getting smaller in size, what they're doing, remember, is they're forcing blood up and out. All right, up and out. But then when the ventricles relax and they re-expand, they go back to their original size and resting state. Um, well, what's going to happen to that blood? Because when the ventricles contract, they generate pressure to drive that blood out of themselves and either out into the lungs or out into the body. And not all of the blood that is ejected out of the ventricles will just go out through all the arteries. There will be some left over, just kind of sitting within these arteries. And you know that the ventricles are the lower chambers of the heart, so you know that blood is naturally, if you just let gravity do its thing, if you take away the pressure that's driving the blood up and out, blood's just going to want to fall back down. All right. And again, this it's just really cool how these valves are designed because these, again, these valves kind of cup downward. Well, that blood that's left over in the pulmonary trunk and the aorta will kind of fill in, will kind of just mix in right in these cusps here, and then the weight of the blood will essentially boom form these valves to slam shut. And it's really, I don't know, I just think that's a neat design. And then remember, while that's happening in the pulmonary trunk, it will also be happening in the aorta, because remember, the ventricles contract simultaneously. And then at the same time, the atria will be filling with blood and they will be relaxed while the ventricles are contracting. And then at some point in time, these AV valves will eventually open, blood will fall down into the ventricles, and then we'll start this whole process over again. It's kind of neat. So that's a neat little design. So those are the pulmonary valves, the aortic valve, and remember, these are the semilunar valves. And then here are your AV valves, or your atrioventricular valves. Now, real quickly, this is, clinically, this is important to know and understand, because there will be plenty of times when you have to be auscultating people. And remember, auscultation is basically listening to the natural sounds that the body makes. All right. So what we have here is the T stands for tricuspid, the B stands for bicuspid. Couldn't find a picture with an M in there, or else I would have rather used that, but you get the picture. Well, you could probably figure out what A stands for, aortic, and then P stands for pulmonary valve. And the pulmonary valve tends to be kind of just behind the medial end of the left third costal cartilage. Okay, because remember, the cartilages that join up with that join the ribs to the sternum anteriorly are called, hyaline cartilage, costal cartilage. And so that's about where you guys know how to palpate your intercostal spaces. So basically, you know that these are your clavicles. Right? If you're working with a patient doing this, you'll just take your middle and index finger and you'll just kind of make a letter V, and you'll go dunk, and you'll stick them, or like a peace sign, and then you'll take the tips of your fingers and you'll feel for that space right between the clavicle and the first rib, and that's the first intercostal space. And then you feel for the space between the next rib, second intercostal space, and then right here would be the third intercostal space. So that's how you would palpate for that. All right, and again, that's important because you can obviously listen to these valves by placing the head of your stethoscope right in that third intercostal space around there. And then the aortic valve lies basically behind the left half of the sternum, opposite to the third intercostal space. All right, so basically, kind of on the left side of the sternum and just a little bit over to the side, as you can see from that intercostal space. Um, excuse me. And now, what's important to understand is that when you're listening to heart sounds, what you're hearing with the heart, when you're listening to heart sounds, is you're hearing the valves slam shut. All right, and the first sound is called lub, and the second sound is called dub. That's kind of what they sound like when you listen to them. All right, and we would call those S1 and S2, and there are other heart sounds which I'll talk about later on. But for now, I mean, it's just important you understand the basics of these valves right here. All right. And these would actually, when you hear the semilunar valves shut, that would actually be S2, the second heart sounds. And the reason why is just because, even though I probably shouldn't have talked about those first, because that might confuse people, but too late now. But basically, it'll make sense when you learn about the cardiac cycle. But basically, when we're talking about the cardiac cycle and blood flowing through the heart, blood enters the atria, goes through the ventricles, and then up through the great arteries. All right. So if we're starting, talking about blood flow through the heart, starting with the atria, blood goes down through these valves and then up towards the arteries first. So these valves are going to be the ones shutting first. The valves between the atria and the ventricles, the AV valves. So when you hear these valves simultaneously shut, that's the first heart sound. And then when you hear the second sound, that would be the semilunar valves closing while the ventricles are ejecting blood out of themselves into the particular circuits of the body. All right. And then if we take a look, um, if we take a look at the tricuspid valve, um, basically, excuse me, it's the easiest to hear kind of on the lower right side of the sternum. Um, so if you kind of palpate almost down to the very bottom of the sternum down here, and then listen in about 3, 4, 5. So in about the fifth or sixth intercostal space, depending on your patient, obviously, but about the fifth or sixth intercostal space on the lower right side of the sternum, that would be about the best area to hear the tricuspid valve close. And then the mitral valve on the left side, um, excuse me, on the left side you can see is kind of audible between in about that fourth intercostal space, kind of just a hair left, left of the sternum. All right. Let's see here. Yeah, and so like I said, and so you can listen to these valves separately and it's important to do because you need to hear, just the normal sounds, lub, dub, lub, dub. That's, that's normal. If you hear this kind of lub, whoosh, lub, whoosh, lub, whoosh, if you hear this whooshing sound, that could indicate that there is, for example, there could be valvular prolapse when the valves don't close all the way or a leaflet gets weak and damaged, and blood regurgitates back up into, the atria, and that's bad. And like I said, you're going to hear kind of a whooshing sound. Or if it sounds like blood is forcefully, ripping through through here, then that could be, stenosis, the narrowing or hardening of the valve, narrowing and hardening of the valves, and so on. So it's just important that you understand where to listen for these heart sounds. So I guess that's just kind of my overview of the valves. Like I said, I know this was short, but I didn't want to talk a ton, just because I didn't want to edit the previous video because I was already talking for, quite a while, almost an hour anyway. But I mean, that's really for now all you need to know about valves, just kind of their general structure, where they're located, the names of the valves, and then when you get more specific into the physiology of the heart and the cardiac cycle, then we'll get more in depth with the valves and talk about blood flow through the heart and so on. But for now, I think this is a good, just a decent refresher, and just kind of what you need to know right now about the valves. And then again, as I mentioned before, as we progress further into the functionality of the heart, then this will get more deep. And again, as usual, if you have any questions or comments or whatnot, just let me know. If you found this helpful, let me know. If you found it not unhelpful, not helpful, let me know as well. Because you're my users, your constructive feedback helps me improve the quality of my videos, and I always appreciate feedback, even if it's negative, as long as it's constructive. I mean, if it just keep it constructive. So, because like I said, your input, allows me to make these better. So, and I appreciate you watching these, and hope this helps. And take care.